Kantor. And Dr. Kantor is President Emeritus of the Florida Society of Neurology and the founding president of the Medical Partnership for MS, and is an active member of the Healthcare Advisory Committees of the Multiple Sclerosis Foundation, the Multiple Sclerosis Association of America, and MS Views and News. Thank you, Dr. Kantor. Chief Medical Correspondent of MS World and is the co-scientific director of the largest U.S.-based MS patient registry called Corona MS. He is the past chair of the Florida Medicaid Pharmacy and Therapeutics Committee, past director of the Comprehensive MS Center at the University of Florida in Jacksonville, inaugural Neurology Residency Program Director at the Schmidt College of Medicine, Florida Atlantic University, and past Chair of Education and Board Member of the Southern Headache Society. Dr. Kantor is board certified in both neurology and headache medicine. Let's now welcome Dr. Kantor. Thank you.
Today what we're going to talk about is how to use the resources that you have already inside you in order to get the best care possible. What we're going to do is we're going to look at communication and talk about ways of making that communication even better. We're going to talk about proactive management of your multiple sclerosis. We're going to remind you that organizational concepts are important. This means taking an active role in your healthcare, and this also means that you have to make informed choices, and the way you're going to make those informed choices is by making sure to record things that happen to you, to record symptoms that may occur, and to try to do this in order to make your life better. We're going to conclude with talking about headaches. In 1903, Sir William Osler said, "The best teaching is that done by the patient himself." And no matter what your doctors talk to you about, fancy testing, MRIs, newer technology, what we know is true today just like it was true in 1903. And that is what you know about yourself is more important than almost anything else that your doctors can tell you. And that's why we came up with this idea called MSTAR. The idea of the multiple sclerosis team approach rule is that really the person with MS is the center of that team. On the one side of that team, you're going to have people like the doctors. You're going to have the primary care physician. You're going to have the neurologist, whether that means a neurologist, an MD or DO, or whether that means a nurse practitioner or physician assistant. It means you're going to have the physical therapist, the occupational therapist, the speech therapist, the case managers, all of us who are there to support you. But remember that you yourself are the most important person in that team. And then on the other side, you're going to have the people that are very important to you. You're going to have that significant other. You're going to have that care partner. You're going to have family. You're going to have your community. In many parts of this country, that also means your religious community. You're going to have your job, whether that means retaining your job or whether that means that it's time to apply for disability. It means that your job is going to be an important part of this team. And then there's the MS community. The MS community is a rich community made up of nonprofits, large and small, that are all there to support you. But everyone's needs are different. While some people may have problems with fatigue, other people may have problems with concentration, other people may have problems with movement, other people may have problems with their walking, other people with their sensation. What's going on with you is going to be different than what's going on with other people around you. And so that's why it's so important that you build your team. And when you build your team, you want to tailor that team to your needs. That means you want to have open lines of communication, and that means that you may need to make trades when needed. When you're trying to do that communication, remember that there is an ugly word that can enter into those lines of communication. And that ugly word is jargon. Jargon is a fancy word meaning fancy words. Jargon doesn't have any place in that communication with your healthcare team, either coming from them or coming from you. That means that don't tell your doctor, for example, that you have a neuropathy going on. When you say that you think you're trying to be helpful, you're trying to describe to your healthcare team that you have neuro, like your nerve pathological, you're probably trying to say that you have pain going on. But your doctor may hear neuropathy and may start to think about peripheral neuropathy. And then because they're thinking about peripheral neuropathy, they're going to think about diabetes. Meanwhile, you don't even have diabetes. This is taken away from your care. And so what you want to make sure that you always do is you want to make sure that you take jargon away. Don't let your doctors use fancy words, and don't you try to use fancy words. Use everyday language to describe what's going on with you. Now, how do people perceive their MS? Most people, it turns out, may have MS and not even know it. But when people do have MS and know it, when it means they've been already diagnosed, then a minority will feel completely fine. But many people will feel things such as head fogginess. People will feel problems with concentration difficulties. They'll feel mysterious kinds of pains. They may feel clumsy, and they may feel limitations in terms of their gait, their walking, in terms of their bladder, in terms of their energy. And as you can imagine, for everyone, those symptoms are going to be different. But how do your neurologists perceive MS? Oftentimes, neurologists may see MS and perceive it in a completely different way than you do. They may find it troubling to diagnose. They may say that it requires more time than almost any other diagnosis that they're used to taking care of. They may wish that someone else could do it. They may say, well, I can't make these people with MS happy. I don't have all the tools that I want to have in order to make it. And that may make your neurologist even feel burnt out as well. It may feel that it takes too long to talk to people with MS. They may think that it costs them a lot of money to try to get approvals for different types of treatments and to try to get you with your optimized health care. When you're thinking about your healthcare team and you're thinking about you and your family, what you want to think about is that you and your family need to organize yourself before your office visit. Your office visits are going to be small pieces of time when you go in to see either your primary care or your neurologist or other sorts of healthcare providers. And so what you want to do is you want to come organized beforehand. But you also want to stick with the program that you agree with. If you don't agree with the program, let your doctors know at the time. Don't wait till afterwards to say, oh, well, I don't agree with what's going on. Because then you have to wait till the next office visit. Make sure to see your neurologist regularly. Make sure that you are immunized. What we're learning is that immunizations are very important to try to prevent illnesses from happening, and so you want to make sure that you and your family members around you want to make sure that you do that safely. So talk to your doctors about that. Keep lists. Don't try to remember everything on your own. Make sure to keep lists of your medications, keep lists of your symptoms, keep lists of when problems happen, keep lists of what happened during your doctor's visits. Nowadays, that's become a lot easier than simply using a pen and paper. Nowadays, many people have mobile devices. Many people have other ways to keep those things organized. But what you want to remember is when you do keep those lists and you want to share them with someone, make sure to have them printed out. You can't bring a list and expect your doctor to be able to scan your screen of your phone. It becomes almost impossible to do so. And as we found out recently, the government itself can't even break into your phone when something happens. So when the password is protected and you're unable to open it, it becomes a problem. So make sure to have typed out lists as well. When you're thinking about your healthcare team and you're thinking about your primary care, you're thinking about family medicine. If you're a woman, you may be thinking about your obstetrician or gynecologist. You may be thinking about your family medicine doctor as well. You want to try to avoid quacks, try to avoid miracle cures, try to avoid just supplements, and think about making sure that all your comorbidities, when we say comorbidities, what we mean are things aside from MS that you may have else going on with you. You want to make sure that those comorbidities like high blood pressure, like diabetes, you want to make sure that all of those are taken care of. You want to ask your primary care physician if they can handle the minor illnesses that may happen. If you have bladder problems or you have sinus problems, you want to make sure your blood pressure remains under good control. Your blood sugar or blood glucose remains under control. You want to make sure your cholesterol, You want to make sure your weight. You want to help with stopping smoke. You want to make sure that you don't have smoking as part of the problems that you're doing. You want your primary care physician to help you with screening tests. You want to make sure to avoid different kinds of cancers that can happen, whether you have multiple sclerosis or not, and you want to make sure that you're able to do that. When you're thinking about your healthcare team, you also want to think about what your neurologist is going to be doing. Your neurologist is going to be talking to you about medications, and only very rare exceptions are they going to say that you don't need medications. You want to get another neurologist if you feel like you're not communicating with each other, if you feel like you're not given explanations, if you are told that you don't need treatment and you're not given a reason why, if you are told to stop treatment and you're not given a reason why, if you are told that your MS is simply benign and they say that they can tell that from the beginning. Oftentimes when people talk about this concept of benign MS, it's a diagnosis that can only be made later on. If you're told by your neurologist that you don't need to come in unless you're having problems or unless you're sick, well then these are things that you might want to talk to your doctor about, whether they're giving you the optimal care that you need. If your doctor doesn't look at your MRI, if your doctor doesn't want to examine you and doesn't want to take care of the things that are around you, if they don't want to track the symptoms or the relapses that are happening with you, then these are times that you may want to talk to your neurologist about whether you're getting that best kind of care that you can possibly get. So in order to get good care, what you're going to want to do is you're going to want to make sure that you get your data together. You're going to want to follow through with the plan. If you have problems with the plan, these are things you're going to want to talk about beforehand. You're going to want to have regular neurology visits. You're not going to want to just come back if you're having problems. Your MRI should be done under internationally agreed upon consensus. We have ways of doing MRIs that we think can be more standardized. They involve standardized position. They involve not having skips, not just looking at certain parts of the brain and central nervous system and other parts. We use what we call thin slices. We want to make sure that we look at different aspects of your brain and spinal cord. Oftentimes we're going to want to give gadolinium. We're going to want to give what people will call contrast to be able to see if there's problems or not. Your MRI should be read by a neuroradiologist or a radiologist trained in reading MRIs of the brain and spinal cord, or by a very experienced neurologist. And you're going to want to have comparisons. You're going to want to be able to compare one MRI to other MRIs that you've had in the past. When you're thinking about do's and don'ts, well, some of the things you want to think about making sure that you do is you want to make sure that you have a history of your medical conditions as well as of your medicines. You want to have a history of your symptoms and other problems that you may have had. You want to have the dates and you want to have the types of relapses and how were they treated and when and where. If you have a problem with work, or if you had to skip out on work, or if you have to cut down on work, or if you're not working, these are things that you're going to want to keep a good record of. If you have an eye problem, you're going to want to know what happened beforehand and what happened afterwards. And so what you're going to want to make sure is, if you do have an eye problem where you need glasses, get that vision corrected beforehand, before you even go in to see the neurologist. And bring your glasses, because they're going to want to test your eyes. And if you're not seeing well because you need glasses, it's going to make things even more confusing. You're going to want to bring your forms with you. If there are forms you need to fill out, either for the doctor's office or for your insurance or for the government, these are things you're going to want to make sure to bring with you. But then there's certain things you don't want to do. You don't want to make demands. You don't want to go in and just demand pain medicines, or go in and demand medicines to make you have more energy. You want to have a dialogue. You want to be able to talk to your healthcare team, especially to your neurologist, in a way that's beneficial to both of you. What you want to do is you don't want to just substitute your neurology for all your primary care. You don't want to say, well, I'm seeing a neurologist, so I don't need to get regular care. I don't need to get screening care for other types of conditions. Remember, although multiple sclerosis is a hand that's been dealt to a lot of people, it doesn't mean that it's protective of other things. There can still be other problems that can happen: diabetes, high blood pressure, other medical conditions. And so you don't want to forget about that when you go and just see your neurologist. Don't come to your neurologist's office without having your medications with you, or a very good list of those medicines and where you take them and when you don't take them. Don't expect your doctor to be able to go and run around and pick up other people's MRIs. Those are things that you should be able to bring with you. You want to call up the MRI facility, make sure that they print out for you either the actual films or a CD with your MRIs on them so that you can have them. Don't try to get everything done at once. Try to focus on 3 main things that you think are important for you at today's office visit. What are the top most important things that you want to talk about? By doing that, you're going to make yourself have a better office visit. When you try to just handle everything at once, it becomes very, very difficult to do that. And finally, don't waste time just spending time criticizing what other people have done. Look towards the future. Look towards what you can do to give yourselves the best and most optimal care. The important stuff that you need to know is that your visit time is premium. You're not seeing your doctor every day. And so what you want to do is you want to prepare before that office visit. You want to be organized and prepared. And you may want to ask other people around you, those loved ones around you or your significant other or others, what they think you should talk about when you go to that office visit. Know exactly what your medications are. Know when you went to see a doctor and who you went to see. What was done. You want to make sure to have the records that are needed. This is all very important so that this office visit can go as smoothly as possible. And only by the office visit going as smoothly as possible are you able to get the best care that's there for you. You want to keep a record of the relapses you've had. You want to talk about what happened. You don't want to just say, well, I've had 20 relapses. You want to say what happened during these attacks. What happened during these flares or exacerbations? What did happen to you? What was the treatment that happened? If your blood pressure or sugar is out of control, those are things that you want to make sure that you get under better control, and you want to make sure that you have more information about them. You want to ask your doctor to do an examination, to do even a standardized examination called an EDSS, or Expanded Disability Status Scale score. If it's something that your doctor says they don't do, it may be something they don't know how to do. And so these are things that you want to clarify with your doctor. The idea of doing this is to make your office visit truly your office visit. And that means you want to get prepared. That means you want to come with a list of your questions and concerns. You want to bring a typed out list of your allergies and your medications. You want to remember that just like doctors oftentimes don't have good handwriting, your handwriting might not be perfect either. And so you want to keep that list typed out. That way you're able to change it over time. You want to bring your actual MRI CDs and not just the reports. You want to tell the office that you're going to what the name and contact information is for your retail pharmacy, as well as for your specialty pharmacy where you may be getting your disease-modifying therapies from. You want to know your authorization date. Oftentimes nowadays with insurance, you need to have your medications authorized. And that authorization may last for a year, but it may last for 6 months, or it may last for other amounts of time. And so what you want to make sure to do is to know when that date is. And by knowing that, you know when to schedule your next office visit. And only by doing that are you able to make sure that you get your medications authorized on time and you don't have these skips or lapses in coverage. And if your pharmacist has a refill that they need, you want to make sure that they send out those refill requests. It's good for you to clarify with your office visit at your office whether they want those requests by fax or whether they get them electronically or how it is that they want to receive them. You want to make sure before your office visit that your office has actually gotten the tests that you had. And you want to make sure that everything's prepared so you don't show up and travel very far and find out that you're not getting the care that you deserve. You want to know your date. The date of your prior authorization is very, very important. And it's so important because if you have a date of your authorization that's going to be 6 months down the line, but you're only seeing your neurologist now, your neurologist may not be able to fill out those forms or may not remember or recall as well when it gets closer to that time. You want to make sure to schedule an office visit around the time in a month before or 2 months before that next authorization of the medication so that your doctor can answer honestly and openly about how your care is going. How are you doing on that medicine in order to make sure that you can continue on it? Nowadays, although insurances seem like they cost a lot of money and your premiums have gone up and deductibles have gone up, many people actually feel that insurances are actually a bargain compared to the high price of multiple sclerosis, including the high price of the medications that we use to treat MS. And so you want to really be smart about your healthcare dollars. You want to think about, if you are getting patient assistance, is this actually helping to defray some of your deductible and making it possible for you and your family to have other sorts of care with your insurance? If you're on especially some sort of governmental plan, so you're on a Medicare or a TRICARE, then you want to aggressively talk to the charities about the care. And you want to realize that many of those charities and foundations that give out medications or give out funding for medications run out of money at various times. And so you want to stay in contact with them to make sure that you get the most care possible. You need to realize also that the more medications that you've been on, it's actually easier the next medication that you go on, because when you go through the step edits, as we call them, where insurance companies look at what you've been on, well, if you've been on other medicines, then it makes it easier for you to get on the next medicine. You want to recognize that rehabilitation services, so physical therapy, occupational therapy, speech therapy, these aren't just like membership clubs where you just go and get the care that you need when you need it. These are also things that you need to upkeep and take care of on your own at home. You want to make sure to exercise regularly. You want to make sure to do those techniques that your physical or occupational therapist or other therapist has talked to you about in order to make yourself have the best care possible. If we all work together, then what we can do is make this multiple sclerosis team approach rule turn into a multiple sclerosis team approach reality.
Thank you.